Okay, so this is again a little discussion on how to write M2 and D1, which is for Unit 5 of the Health and Social Care course. It's all about building empathy relationships with the individuals with different needs. So coming back to our learning criteria for section A, two kind of key areas we're going to focus on here is M2, which is about assessing the different methods professionals might use when building a relationship and building trust, and then evaluating how successful those approaches will be. Now, the theory recap, the three theories to do with empathy, building relationships and attachments. First, you've got attachment and resilience, which comes from the work of Bowlby, and it's all about how we build emotional resilience, our ability to cope with stress, change and different situations. He argues is generally linked to the level and depth of relationship we had with our parents. Lots of stuff with Bowlby, really interesting ideas. So ultimately, the better relationship we have, the more confident we will be as individuals, more confident we will be in forming new relationships ourselves in adulthood. It also has an impact on our health. So again, worth looking into the theory and discussing what it has to say. Second theory was empathy theories, how we build relationships and how we empathize with others. Two key thinkers here, we've got Carl Rogers, who brings in the idea that we should have client-centered processes where we should be genuine, honest, accept what people have to say, and treat them with positive regard and empathy. And then Maslow, who introduces hierarchy of needs and how we all share similar base needs in society. And then lastly, the triangle of care is an aspect of supporting people with mental health concerns. So the triangle of care was used as a three-way partnership, so building a relationship between the individual, healthcare professionals and kind of a key worker, ensuring that information was shared and people are updated on supporting one another. So again, three key theories that we've covered. Now, if you think about how they apply to case study characters, in terms of attachment and resilience, we can talk about a fair bit here. The main thing I think we should consider is who have these case study characters got to form a relationship, a bond with. The more attachments or more secure attachments that we have, the better they will be at coping with stress. And I think it's quite interesting if you look at cases like Nusrat, who has a good relationship with her mum, so would have some resilience, but we could look at the idea that the friends list and the limited friends that she can interact with could reduce her resilience. If she could form new relationships with a boyfriend or with other friends, that could help her resilience. I think also Maria is an interesting case because she has a good relationship with her mum, but it's also worth looking at trying to care for her mum. The relationship we have with her mum is the cause of her reduced resilience. So again, quite an interesting case there. Martin has lost his family, his colleagues, his woodwork class, so he's got a limited range of attachments, so maybe less resilient. Brenda has very few relationships from what we get from the case study, so again, limited resilience. We can maybe see that with her inability to cope with the asthma. Alice has lost her partner, which is a source of why she's lost her resilience, led to her alcohol problems. But also maybe if she can't attend aerobics, that reduces her attachments further. And Patrick, again, he has attachments, he has connections with James, but maybe we could consider the fact that the HIV diagnosis could put a strain on their relationship, and that could affect his resilience. In terms of empathy, moving on to that second column, obviously how we interact with these individuals, how we form empathy, how we build a relationship with them. I thought more about this case is what have they got going on? What are their issues? Because empathy is about trying to understand people's situation. And I think these individuals have issues that may be difficult for someone to empathize with. So with Nusrat, it's obviously difficult expressing herself, so it could be difficult to understand her feelings. Patrick has HIV, concerns his life will be shortened. Alice with her alcohol problems, Brenda's mental health and historic abuse, Martin with his low self-esteem, about the redundancy, the skin condition, and Maria trying to provide care for her mum and balance her job. These are quite specific issues, so it might be difficult for someone who's not gone through them to truly empathize and truly understand what is happening here. And then lastly, with the triangle of care, as you can see on the far right, triangle of care relates to mental health and supporting people with mental health issues. And I thought with Patrick and Martin, there are no obvious mental health issues discussed within their case study. So it may not apply to them, but you can say that if you have chosen Patrick or Martin, you can say the triangle of care does not apply, because you can still explain what triangles of care are, but you can identify that it wouldn't apply to them because they don't have any obvious mental health issues addressed at this point. However, with Nusrat, Alice, Brenda, Maria, there's clear mental health issues. You can link it, and what I've put in red are the people who you could talk about forming their triangle of care. Okay, just to wrap it up. So generally, talk about each theory. What does the theory say? How does it work? Who came up with it? When did they come up with it? How was it used? Apply this to your case study characters. So how would the theory help you interact, or how does it help professionals interact or understand what is going on with your case study characters? Maybe you could link it again back to pies. Apply it. So what specifically does it have? How can it be used? And again, this kind of is similar to point 2. Avoid being generic. Try and be specific in the connections. Everything must be detailed, so try and write as much as you can. And with the following point, do research. If you do research and you get stuff from the internet, from the textbook, don't just copy large chunks and just drop it into your write-up. Try and put quotes and links and summarize it. And if you do put a web link, specify what it says, how it works, and why you've used it. And anything you're putting in, try and make the context relevant to your characters. Why are you talking about this? What has it got to do with what you're writing? And then, as always, try and put some subheadings or clear indications of where different theories begin. So you could do a whole section on attachment and resilience, then a second section on empathy, and then a third on the triangle of care. Okay, hopefully this helps a little bit with your write-up for M2 and D1. Good luck with your coursework, and thanks for watching.